Today, in this episode of the Trusted Dentist podcast, we're going to talk about the price of dentistry. And with me, I've got Mariah, who is a dental patient with all the questions that she has put together on your behalf, because she's going to help me answer those difficult questions that most people do not want to ask. Welcome, Mariah.
Thank you, Dr. Bed. So my first one, I guess, would be, why do patients focus so heavily on price?
Look, in today's economy, price is really money out of your pocket, right? Whether it's at the fuel pump, or whether it is at the grocery store, or whether it's booking that vacation you've been wanting for so long, it's all about price, isn't it? However, when it comes to your oral health, price doesn't always equal quality. That is where most patients make mistakes around making the right decisions just in order to save some money.
So I've heard cheap dentistry floating around. What does that actually mean?
So cheap dentistry is often a carrot that, unfortunately, very small proportion of our professionals advertise out there, and is generally a hook to bring patients in. The real cost of dentistry doesn't really actually change between dentists here in Australia, because we practice pretty much within the same environment. We have a similar cost of staffing. We have similar costs of consumables and equipment. And the cost of dentistry is usually prescribed on an annual basis by what we call as our Australian Dental Association. So if you, for example, go to a dentist and the dentist tells you a crown's, for example, $2,000 as an average price, that could be maybe 10% less, $1,800 to $1,900 at one dentist, or it could be $2,200 to $2,300 at another dentist. However, that average cost should remain the same. Now, what if someone advertises somewhere on social media and you end up looking at that and say, crowns at half price, $900? Or even better, 6 crowns for only $800 each, or 20 veneers for only $9,000 when it could have costed about $30,000. Would you take the bait?
I might actually. Can you tell me why I shouldn't?
Well, try thinking about it. If your friendly neighborhood dentist charges $1,800 to $2,000 for a crown, how can someone afford to do the same thing for $900? Really, the answer, you know the answer.
I know the answer.
And there is going to be shortcuts. There's going to be little nuisances. There's going to be some overseas laboratory involved that's going to make it. There's going to be some amount of cost saving the guy has to produce in order to make a buck. The cost of dentistry in Australia is not high because dentists want to make a lot of money. The cost of dentistry is high because the quality of dentistry we have to produce and stand by and be responsible for the community is extremely high here in Australia. We are here to protect the community, which is why we have to use the best equipment, we have to allow adequate staffing, we have to use proper laboratories, and we have to stand by our work if something goes wrong. And all that costs money. So that is the reason why the dentistry is expensive in the eyes of the general public. But if you put that into perspective, it takes a lot to be able to do proper, ethical, long-term treatments for dental patients here.
That makes a lot of sense. So this actually brings me to another question that I had on my mind. A lot of people here, and actually I'll give an example of a friend of mine. She was quoted something in the tens of thousands of dollars for a full set of veneers here in Australia. But then she went to Thailand and was quoted something as small as 1,000 or even less. I can't remember the exact numbers. What would be the risk involved in that?
That's an excellent question, Mariah. Tourism dentistry is garnering a lot of momentum here because obviously, like I said, price pressure, right? Now, in Thailand, what actually would happen, let's just not say Thailand because it could happen anywhere in the world, right? Whether it is Turkey dentistry, it could be, China, India, Indonesia, one of these countries where the cost of labor and materials is far lower. Now, the dentist there is not of lesser skill than a dentist here in Australia. They have access to good dental schools, they do train a lot, and they do invest in their dental education. What actually happens is the pressure time bomb when people go in as a tourist into these countries. So when let's just take a real story of one of my patients, right? She came to me like your friend, who wanted veneers. This patient wanted dental implants, and she was in her mid-40s, and obviously life had taken over. She had lost a lot of teeth, and when I looked at that, it did require pretty much a full mouth rehabilitation. Now, something like that would cost about $45,000 to $55,000 a year. It's a treatment that would span over 12 months. It would probably need about 20 appointments. It would require major surgery. It would require recovery time. It would require me to produce temporaries for this patient and also take care of her for multiple appointments over a period of 12 months, right? So this patient obviously couldn't afford it. She looked up, dentistry overseas. She went to, a overseas destination, and she booked a dentist appointment online. So she asked for all her records, which I provided her promptly, no issues with that. She sent her x-rays across by email. The dentist online quoted her about $8,000 Australian, as opposed to the 50,000 we quoted her. So she took the leap of faith. She decided to, have a vacation at the same time, and I didn't hear from this patient for about 18 months. And I completely forgot about it till she showed up in my rooms 4 weeks ago. And she had been a bit unwell. She had gone and seen a GP. The GP told her she was getting dental infection in her mouth and she needed to go see the dentist. So very hesitantly, she rebooked her appointment with me. And as soon as she walked in, she apologized for not coming and seeing me earlier, that she went overseas. And I was completely okay with that. I said, look, I'm here to solve your problem today. Tell me what's happening. And she had flaring infection and inflammation in her mouth from the dental surgery she had overseas. 3 or 4 of the implants were already failing. This is within 18 months. The jawbone infection, which we call as osteomyelitis, had started to spread into her jaw and was slowly eating away the jawbone, and she had pus oozing out of multiple pockets in her mouth, to the point where she had been suffering for last 7-8 months. She had lost some work. She was not herself. She had lost her confidence. She had lost the ability to go out in public, and it was affecting her overall social and well-being. I felt really bad for her. We did some initial x-rays and we realized that her treatment was going to need specialist attention, and I had to refer her off to an oral maxillofacial surgeon, a specialist who specializes in jawbone surgery. And I have no doubt her work will have to be redone after all the infection has been resolved. This would end up costing her almost double of what she could have easily spent over a period of 12 months here in Australia. So these kind of stories is what makes it really difficult to make a right choice when you're going overseas. You have very little time there, a lot of treatments done in a very short span, and there's no responsibility for after. So would you really put yourself through all that pain?
Yeah, that is terrifying. So you've kind of answered my next question, which is, what would be the hidden costs that people might need to be aware of in this situation?
The hidden cost here is of redoing that dentistry. Maybe not tomorrow. Maybe those veneers look very sparkling in your friend's mouth today, and maybe they will be okay for a period of time. But usually, if that dentistry has been done in haste, without proper protocols, without a good laboratory, without quality materials that have been registered by what we call as TGA, or Therapeutic Goods Association, then things are going to fail. And when things fail in the mouth, it's usually irreversible damage, and it requires a lot more than just replacing them with veneers again. So that is the real cost.
Yeah, absolutely. That's terrifying. So how can patients compare quotes properly?
Look, quotations are very difficult. So let's put it this way. Say you go to a dentist and you need X amount of dental work and you get a treatment plan. Now, treatment plan is a medical piece of document. A quotation is what your roof plumber gives you when you have a leak. So when you look at a treatment plan, the treatment plan could be very different in my hands as opposed to Joe Black, my friendly neighborhood dentist, or even my own associate that's practicing in my business, right? Because as a professional, we look at problems differently. We might have different solutions and we might have different timelines, which is why a treatment plan is a customized treatment for that patient that is made by a dental professional, which takes into account not only what treatment needs to be done by, but also the patient's age, the problems that are pre-existing in the mouth, their medical condition, the level of dentistry that mouth can, sustain over a period of time, and also the post-treatment maintenance protocols that can be put into place. All of those factors can change the treatment plan dramatically. So when a patient walks into my practice and says, here's a code, can you match it? I try to give them the same analogy of a roof plumber, and I am not a tradie. I'm a dental professional who spent 8 years in dental school just learning little nuisances about oral health issues and treatments. And we need to make sure that patients understand this. And no one treatment plan is the same. There are multiple options, and not all options are for everybody.
That definitely leads into my next question then. When is a lower cost option actually an okay option?
Yeah. Look, excellent question again. Not all low cost options are bad options either, right? So let's just say, for example, you've got a pain in your tooth and you go and see a dentist you haven't been in for 3 years, and you open your mouth, the dentist takes an x-ray and finds out a cavity that's happening there. Now, obviously, the first line of treatment should always be trying to get you out of pain, and that is they will, probably excavate the decay, put a temporary filling in it, watch the tooth. That's a low-cost option, and that's okay for a period of time, as long as you understand that that is for a short period. Say you leave that filling in there, that temporary option there for 2 years, bacteria is going to grow around it, the tooth gets weakened around it, it might develop a micro crack in it, and I can assure you, one day you're going to bite on a multigrain seed bread or a strawberry or something which has got something a little hard in it, and boom, that tooth's going to crack again. More than likely, that's going to end up in a root canal. And then that root canal is going to be thousands of dollars, which then would need a crown, which is another few $1,000s, and then probably an extraction 5-10 years down the track. If that fails, which might end up in a dental implant, which is even more money. So what is the true cost of the dental cavity? It comes back to my patients coming in regularly for checkups, for revisiting the plan, and obviously following through with that low-cost option to fixing things up properly for the long term.
Amazing. That's so much good information here, Dr. Ved. Thank you so much for answering all my questions.
Thank you, Mariah. It was a pleasure talking to you. If you're on a journey to improving your smile, take your time and ask the right questions, and always seek understanding before making a decision, because the best decisions are informed ones. If this episode has helped you in any way, share it with someone who might need it.
This podcast is for entertainment purposes only and should not be taken as medical advice. Before making any treatment decisions, please seek independent medical advice.